Good evening, everyone, and welcome to this evening's discussion with Josephine Ensign. My name is Anna Patrick. I'm a journalist on the Project Homeless team at the Seattle Times. We are a team of 4 solely dedicated to covering our region's homelessness crisis. And I'm really excited that you all could join us this evening, and I'm excited that Josephine could be with us tonight to talk about her recent book, Skid Road. Josephine Ensign is a professor of nursing at the University of Washington. She's also a family nurse practitioner and has been providing healthcare to people experiencing homelessness, both adults and young adults, for more than 30 years. Her work has also expanded to serve people from all backgrounds and ages, from birth to death. She's also experienced homelessness herself when she was a young adult living in Virginia. She is the author of 3 books. Her most recent book, Skid Road, On the Frontier of Health and Homelessness in an American City, published last year, and it's what we're going to be focusing on this evening. It's really a historical narrative that looks to Seattle's earliest white settler past to help uncover and tell the story of Seattle's history of homelessness and healthcare from the mid-1800s up until now. Ensign digs into how we as a place took care of our most vulnerable, what principles and values and policies guided that work. And she really helps to show that for more than 160 years, Seattle's institutions have grappled with the same questions around homelessness ever since. Whose responsibility is it to take care of our poorest? How do we pay for it? And where do people live? So now, as time is of the essence, and we've got a lot of stuff to get into, Josephine, I just want to say thank you so much for joining us and welcome. We're really happy to have you.
Thank you, Anna, and thanks everyone for being here tonight.
Let's just go ahead and jump straight into it.
Let's do it.
Let's do it. Yeah, we got a lot of questions to get to. So for our listeners and attendees, I thought maybe a good place to start would be with getting to know you a little bit better. Josephine, could you just tell us a little bit about how you ended up in Seattle, how you got here, and how you got involved with the work that you're doing, supporting and providing healthcare to Seattle's homeless population?
Okay, I'll give you the distilled version. I came here in December of 1994 to start as a very junior faculty member, assistant professor at the University of Washington School of Nursing. It was before I finished my dissertation. I was still working on that, which focused on health beliefs and healthcare access for homeless and foster care teens in Baltimore when I was at Johns Hopkins. And I was drawn here both because I fell in love with the city when I came out to interview. I was a single mother at the time of then a very young child, and felt that it was a good place to raise my son. And also because of what was going on in Seattle, which I felt was really exciting around real interventions in terms of homeless young people, or young people, teens and young adults experiencing homelessness. There was a partnership for youth started by Nancy Amadei at the University of Washington, kind of cross conversations with the community, with police, and so I was really excited about that. So that's how I got here.
Wonderful. Can you tell us then, from your time here and doing work here, what led you to writing Skid Road? What inspired you to make what has become this book? And also to that, like, how does your medical background or healthcare background inform the way you approach this topic, the way you researched and thought about tackling this book?
Okay, 2-part question.
Yeah.
Trick question, Anna. Okay, so
I'll start. You can do them one at a time.
Yeah. So I'll start with the last one that I actually remember, and you can remind me of the first one.
That sounds good.
So I've been a nurse for over close to 40 years, nurse practitioner, family nurse practitioner, and started off in my then hometown, Richmond, Virginia, and worked on one of what became one of our country's first healthcare for the homeless programs. It's still in existence in Richmond. It's called the Daily Planet. It was, when I worked there, more of a faith-based group, and worked. I mean, this was I think I started there about 1985, and so this was really at the height of what we now kind of in retrospect call the new homelessness, the wave of homelessness, and was learning about homelessness kind of firsthand. I did street outreach under bridges along the James River, went into family shelters, and also in SROs, single room occupancy hotels in the downtown part of Seattle, and then through kind of a series of events, severe depression, and also a clash of worldviews with the Christian organization I was working with. I became homeless for about 6 months before I extricated myself, but had a lot of supports. Obviously, I already had an education and had many other privileges, but went to Baltimore, got out of my hometown, which was not good, and continued working as a nurse practitioner while I was in public health school. I worked in East Baltimore, and I also worked as the only nurse practitioner in a couple of shelters that worked with street-involved youth as well as foster youth in Baltimore. And then continued that work when I was out here, 45th Street Homeless Youth Clinic, worked at a lot of the different community health clinics in Seattle, like Country Doc and Carolyn Downs, and have worked on research and also policy kinds of things, and always with health lens, but with more of a public health lens, which is much wider. It includes what we call the social determinants of health and health equity. So, where people are born, go to school, live. So housing is a huge part of that. And what was the first part?
Yeah, no, this is great. That was wonderful history too, Josephine. So then what led you to decide to write Skid Road?
Skid Road. And that, again, I was drawn to the city, not just professionally, because of what I felt was exciting. And at that point, I was living in downtown Baltimore, Bolton Hill, doing street outreach, working in shelters. And, these were the years of what was captured on The Wire. If anybody has read or watched, that show is extremely accurate for what I lived through. It was very just surrounded by daily shootings and violence, etc. And so I was attracted to Seattle because it felt like a more hopeful city. And this is this goes back to our history, right? Of why people have over decades and a century wanted to move to Seattle for new opportunities, and felt it was also more progressive politically, socially, and then realizing, just struck by the widening disparities, socioeconomic disparities, large corporations bringing in a lot of wealth, and then abject poverty, right outside my door, literally, as well as with people that I am working with. So I started asking myself, how did we get here? How can this progressive, forward-thinking, I think of it as a compassionate city, have one of our country's largest and gnarliest problems of homelessness, and looking at the healthcare component of that, being fascinated by the history of Harborview Medical Center and, you know, King County Poor Farm and the nurses who helped to start that off, the hospital. So that's what started just the idea for Skid Road. And it really was literally when I was walking down Yesler Way from Harborview to work at Chief Seattle Club with some of our students, and having started to read books like Murray Morgan's and realizing this was the original Skid Road, and just kind of asking why.
That's really interesting. And I know you shared as well in a previous discussion that question, that little seed, right, was planted maybe 10 years or so ago, or like this has been something that's been forming over time, right, for you.
Yes, that's true. Yeah, and I also wrote two other books in the time. So I was, you know, the seed was there, and I had started to do some of the research for it. But yeah, and also the kind of observations and other sorts of research.
In the prologue of your book, you described that scene really well, right? The walking down Skid Road, walking down Yesler Way, and I think it really, kind of sets up the reader, right, for this journey that you're going to take them on. Yeah, speaking of the journey, let's start too with the first chapter of your book. It focuses on the case or the story of Edward Moore. He's Seattle's first recorded homeless person. Yeah, can you tell us a little bit about what happened to Edward and why? Yeah, tell us a little bit about his story.
So from doing historical, you know, archive research into his story, and he is mentioned by Murray Morgan in his book Skid Road, but more as a kind of an anecdote. There wasn't a whole lot else known about him at the time, but he was found by white settlers, you know, Doc Maynard and Henry Yesler and others, most likely at the end of December of 1854, on the beach in Seattle Beach, which is what is now kind of the Belltown area of Seattle. It was had a long history of having been an indigenous camping and shellfish processing area. It was where butter clams were located. So it seems as if Coast Salish people had been helping to take care of Edward. And he had been there for at least 4 months or so. He was found half frozen. So they took him, you know, to the Yesler rooming house kind of area. And Doc Maynard amputated most of his toes with an axe, and then helped to take care of him, and various other kinds of doctors took care of him, including down in Steilacoom. And this was during the time the poor laws for Washington Territory had just been enacted that May. They were in effect, and it made counties the people, the government entity responsible for taking care of poor and injured people, you know, within their counties. They stipulated at the time the person had to have residence, had to have been there for at least 6 months, but that no matter how long they'd been there, if they were sick, injured, the county was responsible for taking care of him. And they had, you know, they actually auctioned off the care of poor people. So that's what they did with Edward. And they petitioned this Washington Territorial Legislature for reimbursement for his care. The legislature said, even though, you know, all the finer feelings, like it was, you know, really sad case, that they couldn't set a precedent for paying that amount. It was actually more than the territory had taken in a year. So they sent him back to Seattle, and then people in Seattle just took up a donation, shipped him back to his home state of Massachusetts. And that's where most of the histories end.
Could you talk a little bit about what you found, though? What makes your
Yes.
narrative from that.
Yeah, so that's where all of the kind of official histories of Seattle, and even in the archives, that's where it ended. Is just kind of like, we shipped him off, paid a ship's captain, they bought him a new suit of clothes and shipped him off. And it also, what is also pertinent, I think, is that it appears that by what our standards, like what we use in terminology, he most likely had schizophrenia. There's no indication that he was an alcoholic. It does appear that he was a shipwrecked sailor. And so, and he also, one of the problems with tracking down what happened to him is he has a very common name and no middle name. But I always say I love librarians. It was a librarian in Worcester County, Worcester Public Library, who found his death register in Ashburnham, which is in Worcester County, where he'd been living with his sister's family, and his elderly parents. And he hung himself and died just several years after he had returned to his family in Worcester County.
Yeah, he wasn't there for too long, right? Once he came back.
No. And it's interesting because at that time, Worcester County, they had an insane asylum that was kind of like state of the art. It was one of the best ones in our, kind of what was becoming United States. But there's no record that he was sent there. He probably, which was the standard at the time, because families were responsible for the care of poor people, of people with mental illness, that he died, while under their care.
Let's transition to the next question. We've got Josephine. In your book, you in the early chapters as well, you really incorporate how racism has affected like the way that early white settlers strategized and approached taking like homelessness. I'm especially thinking about chapter 2 of your book, which focuses on Chief Seattle's daughter, Kiki Sobu, who lived in what was later like properly termed Shacktown, right? On the edge of Elliott Bay in what is now like Pike Place Market. Yeah, can you talk about where you see connection there between race and class and homelessness, both from our history and maybe how that might still be affecting the way we approach things today?
Yeah, so that I tell people that chapter was one of the most difficult for me to write, not because it did take a lot of research, but also just wrestling with being a non-native person myself, of being respectful. And I did have input from some writer friends who are Indigenous, but I really felt a responsibility to Kikasumwa to do her justice. I mean, she, by all indications, she was a really gutsy woman and survivor. So, and with her story, I mean, it's not only, I mean, she was, Chief Seattle's daughter. She saw, and she lived a long time, and she saw the settler colonial town growing exponentially. And there's like a story by one of the early ministers where she pointed at a map and was saying in Chinook jargon, all of this, was my father's land, and was really angry about it for good reason. And she refused to leave. I mean, we had a law in Seattle early on that really banned Indians. And then, people who were marginalized. So, obviously early on, Indigenous people who were taken off their lands. And we know, I mean, she was Duwamish, and the Duwamish, still are not federally recognized, and when we're on the unceded grounds of the Duwamish. But also an increasing number of people that were marginalized for other reasons, poverty, recent immigrants, especially if they weren't English speaking immigrants, or they were swarthy complexion, people who are Black, and Asian. I mean, all of these kind of what we started, calling others, and even our land use, and the racial restrictive covenants, just really outline where people could live. So people found, I think you pointed out, people have always found these kind of niches, these areas, unused land. I mean, the Hoovervilles that we had during the Depression, they were on, not surprisingly, on city dumps. So, people find ways to survive. And so, yeah, there was this they called it Shack Town. There was a Shack Town early on in what's now Pioneer Square, because that was always, the deadline, that was always designated as the kind of red light district, but then also along the Belltown beach.
Maybe we'll just jump into that question too, Josephine, around Shack Towns, just because we're talking about it, and then I'll circle back to some more reader questions. But yeah, speaking about how it seems like for more than 100 years, poor people have figured out ways to carve out small communities for themselves when the larger society has kind of pushed them out, right? Or extricated in some way or otherized, right? Shanty towns, Hoovervilles. I'm just curious your thoughts too. How do you think our modern day homeless tent encampments compared to these past versions? How do you see parallels between the two? That's what my brain immediately thought of when you described a lot of these communities.
Right, as well as, of course, tiny house villages nowadays. A little bit different.
You call out really well in your book too, right?
Yeah, I mean, they do resemble what the shack that Princess Angeline lived in and died in. So yeah, I mean, people need basic human needs, shelter, safety, food, clothing, warmth, and also then community, supports. And so if people are excluded from other ways of getting those needs met, they find ways to have those basic, I mean, they're human needs. That's what all of us need. So the tent encampments, and those have been, again, over the years, even early on or after the Great Fire, we had tent cities, with different kinds of emergencies, housing emergencies. There are also, early on, like the anti-vagrancy laws in certain cities, and including Seattle, there were only certain places where you could camp or lie down if you didn't have a home, and that tended to be, again, in Pioneer Square, south of the Esser Way. The north part of that was more respectable, so they couldn't. And so people would actually have to then move and find a camp, somewhere, even if it was on the outskirts of town. So we know that goes on and increased exponentially during the COVID pandemic, because we had to close or severely limit the emergency shelters that were more crowded, and that contributed to the rapid spread of disease. And so people went where they could be, and so that does kind of replicate all of that. We do know, on a national policy committee looking at the increased rate of criminalization of homelessness across the country, the increase again now with sweeps or encampment clearances. And for some of those, I understand, I mean, in terms of safety, health concerns, but we do know that encampments, people prey on them. Like a lot of the violence that we even see today it's not necessarily people who are living there, it's people who are drawn to those for different kinds of things, especially around, for instance, the meth pandemic that we have now.
I think your book helped to illustrate as well, and I think it's something that's easy to lose track of today, right? That a lot of the tension that we might see, right, through 10 encampments, has existed for a long time, right? Like this tension isn't a new thing. Yeah, like you said, like there have been tent cities or people that have cropped up in areas that maybe others weren't so happy about, but in proximity or whatever for the reasons, right? But it was a kind of a reminder to me too that although some of these problems might feel brand new, they're actually have been around for a long time.
Mm-hmm.
I'm going to turn to a reader question now.
Okay.
So we had Laura Weiss from First Hill in Seattle. She was really curious about a person that you focused on in your chapter. Her name goes by the name Tiny, a teenager who was homeless in Seattle in the 1980s. And she wondered if you could talk a little bit more about Tiny's story, what you learned or found from focusing on her. And then I'll ask you a part 2 question as well. If there were other people, I found it really interesting that your book, really started each chapter, right, by looking at someone's story, someone who was marginalized, someone who might have been like Edward Moore, a side note in previous histories of Seattle, but that you spent a lot of time really getting to know and understand them and understand, right, like what their experience could illustrate about how we've handled this crisis for a long time or how we've handled poverty or homelessness. So yeah, sorry, that's a very long-winded question.
Yes. So probably up there with with the chapter on Kikasumla, Princess Angeline, the chapter Threshold on Tiny's story, Erin Blackwell, who's still living, and the content around that, especially commercial sexual exploitation of children and teens that still unfortunately goes on today, wasn't just something in the 1980s, and it was really difficult emotionally to write, and also because I've worked with young people like Tiny throughout my entire career. I worked with prostituted teens in Richmond, Virginia, and whose customers were well-known politicians, and some of the same kinds of things were happening, especially during the 80s here, and also judges and others who ended up being pedophiles and preying on our street involved young people. So that one was difficult. Also the fact that Tiny is still living, and I did not want to dishonor her in any way. I chose to focus only, for the most part, only on what is in the public record. She's been very, very, very public with her story. And then also I focused on Mary Ellen Marks and her husband, but she's a photographer and she was a videographer who did a documentary. Did a first, I think it was in Life, story about Tiny, and then a follow-up film called Streetwise that really starred Tiny and some other young people from that time, and thinking through the ethics of that. And sorry, Anna, Seattle Times, but the role
this is good.
The role of the media and the ethics of journalism, of good journalism. There's, at one point, Mary Ellen Mark and her husband, who were childless, wanted to adopt Tiny and take her back to live with them in New York City, with the stipulation she had to go to school, and she decided not to. And just thinking through and also being in conversation with some of the other young people who had been on the streets with Tiny at that time, about why they did not want to get involved with that and what they saw as the bad effects of being involved with specifically that documentary on young people that they knew. And then also, you know, I didn't write about this in that chapter, but then also like questioning myself, like, you know, what right do I have to be writing about Aaron. So that was a really interesting chapter. I've worked with, again, a lot of young people who have been commercially sexually exploited. I've worked on, you know, task forces and programs to try and address that in our region. And that's where I will leave that.
That's really great. Anyone else that has kind of followed you from your book that you focused on, or that you didn't know too much about, that really sheds interesting light on Seattle's history that otherwise most people would have no knowledge or recognition?
Yeah, and I should say, and again, that the answer, but also connecting the last question, I did not know Tiny personally, but I knew a fair number of the young people that were in her group and that were included in Streetwise. You know, when I first started working here in 1994, the only person, you know, in any kind of highlighted in any of the chapters that I actually met, I didn't know her in depth, but you know, I met her, was Hazel Wolf. You know, it's quite a local personality, national personality. I think they've all stayed with me. Maybe not so much the sisters, you know, because it's interesting. Some of the early feedback on the chapter that has to do with the sisters of Providence who came here to start the King County Poor Farm and Hospital is that I was referring to them as the sisters instead of like an individual. They call themselves the sisters because they, you know, they go against individuality. Edward Moore definitely has stayed with me. And something that I'm working on now, my next book on contemporary situation, the contemporary landscape of homelessness in Seattle, King County, is Lisa Bach, who you know, was murdered by Travis Brugge, and again questioning the role of the media in that completely avoidable tragedy. So, and that is something that surprised me, I think, in writing this book, because except with the exception of Tiny, who is still living, the people that I highlighted in the different chapters are, you know, are dead, or, you know, in some cases like Edward from long in the past, and how much empathy I developed. I mean, I felt like I was at some level starting to get to know them as people, and then wrestling with, again, like how much, I mean, it might sound strange, but I would even have like conversations with them in my head about like how much and what was okay to tell about them, because there's more information about Edward, for instance, that I decided was not relevant to the story. It was more, you know, it wasn't relevant, so I left it out. So that did surprise me.
That's really interesting. It's like having inner dialogue with them as you go on this journey.
Oh yeah. Oh, I'd have dreams where Kikasomlo would be speaking to me.
Really?
Yes, I did. Yes, she would speak to me forcefully. So,
Oh,
yeah.
wow. That's really interesting. I am going to jump. This is a little bit of a like left turn, just because we're getting a lot of great questions. And I think this one that we just got kind of applies to a lot of what we've been talking about around people you focused on, but this looks more to kind of the general policies. Christian, who's listening right now, asked this question: are there any success stories in this history?
Success stories, and specifically in Skid Road?
in Skid Row, yeah, whether it's a policy, strategy, something a person
Mhm.
did,
Oh yes, definitely. And I get into that in my final chapter, state of emergency, kind of going over our endless processing 10-year plans in homelessness, that did not really work. But programs and people who have come up with innovative solutions that have worked. I mean, I think of like one of my local heroes, Jim Theophilus, especially in terms of working with homeless youth. He was actually working, down, the time during Tiny in the 1980s, working as a street outreach worker. And the series of programs that he has built with young people and advocates over the years. I mean, the Mockingbird Society, especially for homeless, for foster involved youth, but also homeless youth, A Way Home, which is a model across Washington state that's very effective at preventing and doing early interventions for homelessness for young people. So, thinking of and looking at some of those success stories of where we could definitely be a lot worse off right now if it weren't for people and programs that have stepped up and done really amazing work and continue to do really amazing work.
I'm also going to ask another reader question now. Thinking about things that might have existed in our past that have almost entirely kind of been eliminated and has impacts on homelessness today. Rick McKinnon from Seattle's University District, he wants to know what impacted the redevelopment of Belltown and the loss of single room occupancy housing, SROs, there and throughout other parts of Seattle have on the city's low and lower income population. This is a little bit more of a modern day problem, but yeah.
Yeah, not so distant past, still going on, but that is a really interesting story in history. And of course, Joe Martin, who recently retired from Pike Place Market, really has a lot of insights. I've interviewed him about this because he was there, witnessed that whole change, and that, I mean, it's a similar story. I mean, when I was working in Richmond, Virginia, and this was happening in the 1980s, where SROs were considered unsafe, and in many cases they were unsafe because they were in kind of original, dilapidated, mostly wood frame housing that had just really run down. That was a fire hazard, as we had here in Seattle with the Ozark fire. And so there were good reasons for wanting to do something different. But at the same time, the SROs were kind of the places of last resort, and at least had a locking door and access to bathrooms and the kitchen and some sort of community building. And they weren't only for people who were near homeless, but also for artists and others. I mean, Jack Kerouac stayed in kind of an SRO a bit, or at least an interesting hotel when he came through Seattle. So they served a purpose for a population. And I was talking with Sharon Lee this afternoon, executive director of Lehigh Low Income Housing Institute, and she was involved also with that whole time with SROs coming down International District as well as in Belltown, and then the disconnect with what was put in place instead of them, which was market rate, really geared towards high income renters. And they were able to hold on to some SRO, especially around Pike Place Market and others, and then through DESC and Lehigh and some other housing places here. But they served a purpose. And also, as Sharon was pointing out, and as Joe Martin points out, now our emphasis and what happened starting, especially during the pandemic, because of the spread of COVID, was buying hotels and motels and converting them into housing, for people experiencing homelessness, and they essentially are SROs, although at least they have a bathroom and a little like kitchen usually per room.
I'm thinking about that, about how maybe a lot of these strategies have been tested and tried in different ways or in different forms over time. And in some ways, just under kind of the guise of a different name, right? From SROs to small hotel rooms. I'm going to ask another question from a reader, Sherry Miller from Bothell. She wants to know, with the knowledge that what has been tried in the past to address this issue of homelessness has not been successful, what is preventing us from trying new ideas rather than repeating history?
Yes, that's a good question. And I know a lot of people, for good reason, are frustrated at our lack of progress, and we're actually going backwards in terms of the sheer numbers and visibility and suffering of our neighbors experiencing homelessness. And that the answer I would have to that, and it's also related back to the previous reader question about what the success is. One of the successes that we've had in Seattle that we've been at the forefront of is housing first. Of the kind of like idea, but of first offering a safe, a stable place for somebody to live, and not having any strings attached in terms of you have to go to treatment, you have to take these therapy, or you have to go to therapy, or you have to take these psychotropic medications, but at first getting them in a place that's safe and with supportive services, so that that once they start feeling safer, they start actually decreasing their use of substances. Their mental health is like, of course, for any of us, our mental health would get better even just by having that, not even with having access to therapy and medications. So that's something that we know works. It's evidence-based. Yes, it's expensive, but I was at a presentation yesterday. This is from Plymouth Housing, and other statistics with people locally that I think is amazing. 3 days stay inpatient at Harborview equals 3 months of the cost of staying at King County Jail, equals 1 year of permanent supportive housing. And that's not even factoring in, fire and emergency, kinds of calls. And that, we also see with 1811 building, which has been around since 2015 for chronic inebriates in Seattle. So we know what works. It's an issue of scaling it up, but of also, in my opinion, having choices. People become homeless for all sorts of different reasons. I mean, yes, there are commonalities, there are, personal, individual vulnerabilities, also these structural kinds of issues. And having a choice in housing, having tiny house villages for some people, it's definitely safer and better than living in a tent, in an encampment. It's not a solution to homelessness, but it's one part of the piece of the puzzle. I am intrigued by like social housing that's being discussed more, as well as like kind of consumer-led models like we have with Share Wheel. So I think of having that, and also as Sharon Lee was pointing out today, which is so true, the visible homelessness, people that you encounter on light rail, on the streets, that for the most part are part of the chronically homeless population. And that the vast majority of people, families who become homeless, really just need temporary help, and it's usually financial help, and connecting, with an affordable place to stay, and that can do so much in terms of preventing long-term homelessness and chronic homelessness. So I think we need to fund more prevention kinds of work as well, or better fund. We do have some, but
Needing more people upstream before it becomes chronic.
mm-hmm. Mm-hmm.
Or the longer it goes, the harder it becomes, right?
Well, and also, I mean, we know that children who are homeless face a higher risk of becoming homeless again when they're adults, and even chronic homelessness. And so we know that just getting them into housing, it's not, bypassing the transitional housing and housing readiness, getting families into housing, even if it's a tiny house, is so much better for the children as well as the parents.
One thing I want to get into, because I don't think we talked about it too much, but it was something that really struck me in your book, is the English poor laws. And I know that you got a Fulbright scholarship to go to Scotland and London and research all about this, right? But really, those laws begin in the late 1400s and greatly impacted early America, right? And in thinking about how we take care of our poorest. And like you said earlier, it helped to create this framework of how things are funded, whose responsibility it is, but also it helped to, or it really created this idea of kind of like sturdy poor, able-bodied poor, deserving poor almost, as like it created division, right? And I was curious too, just because we've talked about this, and I think it's really interesting. Yeah, where do you see that history still reflected in policy today?
So much.
Yeah,
so
can you just
much,
give us some
so
examples?
much. So yeah, I mean, I was very fortunate. Love Fulbright. Thank you, Fulbright. And was based in Edinburgh, but yeah, I also did work in London, and really tracking down in their amazing libraries, the whole history of the English poor laws and the worthy and unworthy poor. And we hear that echoed today in everything in our debates about welfare, about who deserves Medicaid. It goes back to the English poor laws, where they were basically sorting people. The worthy poor were widows, children for the most case, although they also felt like children could start working immediately if they were able-bodied, and people who are blind or disabled, deaf, were considered, or people with they didn't call it this then, but mental illness. And the unworthy poor were everybody else, especially able-bodied men, able-bodied children. There were not the child labor laws, of course. And those came to the 13 colonies. And then as territories and states formed, they adapted those original English poor laws. And it started off in England and Scotland. That was very much parish based. I mean, that's where kind of the seat of government, and who kind of doled out different things. And the warning out part of it too, that if you weren't from here, you better, by golly, get going if you didn't have money. And that we see today too, right? The whole trying to bus people back to wherever they came from. Although we know the vast majority of people homeless in Seattle, King County became homeless here. They're from here. And so all of those of just recognizing the echoes. And I got furious. I mean, there was a point in Edinburgh, and it was Scottish people probably didn't understand it, but I started getting so angry that I didn't know more about this, that is not included, was not included in my public health education or my nursing education. It's only really taught in social work or maybe poverty studies. But I felt like more people need to understand the origins of this, and and how then it became part of the state for doing that, and how these kinds of echoes and the Judeo-Christian, the work ethic and everything else, reverberates in our our conversations today and policy decisions.
I find that really fascinating that it tracks over how many, more than 500 years, right? It's pretty interesting to even think about how maybe belief systems, right, are formed unknowingly. I'm going to turn to some other great questions we've been getting in the chat. Is a lot of folks, and I don't even have a name for this because we're seeing this pop up a lot. A lot of folks are curious about the name for your book, Skid Road, and drawing from Murray Morgan, and curious if you could talk more about that. Let me see if there's anything else. Yeah, why did you choose that title?
Well, I felt like Murray Morgan couldn't have that title to himself. God bless his soul. I never got to meet Murray Morgan, but I've been his daughter, Lane Morgan, has been in touch with me. He somebody I wish I had known. And that's why even the preface he called his one man Seattle, called it One Woman Seattle. But because again, that kind of the origin story of my book was really on Skid Road, and just wondering, yes or way, this was called Skid Road. Where do we get the word Skid Road? And it really does seem as if Seattle and Yes or Way was the original Skid Road. Vancouver, BC tries to, they try to claim it as well, maybe, but Vancouver, BC is flat for the most part. And Yes or Way was the actual road where they rolled the logs down to Henry Yesler's sawmill that was right on the water. And that's, if you walked up that recently, it's still a steep hill. And skids, the term skid were the logs that they cut and they put horizontally, that kind of made a corduroy road. And then they put fish grease on it. It must have been such a great smell. And that's what rolled the logs down. And so, and that Skid Road, Yes or Way, became the official deadline. I mean, that, south of that, pretty much anything went. And that's where they could have the bawdy houses and the thises and the that's and the bars. And the respectable people were north of that. So then, in terms of the use of that term and then widening it to Skid Row, which is what most people think of, that became like those encampments, those unofficial shanty towns or, flop houses became the Skid Row. And then it became synonymous with rolling downhill into poverty and homelessness.
There's a lot there, right? The metaphor, the history, metaphor, the dividing line in a way. We are also getting a lot of questions from readers and viewers, and I like that a lot of this, people are in the same train of thought. One question that's coming up a lot is folks are interested in what lessons we can take away from this history moving forward as we think about homeless policies and apply them.
Yeah, I think for me at least, and what I hear from some readers is, there's this kind of disconnect and this tension between, from the very beginning, settler colonialism, Seattle's had one of our country's largest homeless populations, and looking at why that is. But we've also had, and I don't think it's just like failures, right? That we kind of repeat failures. There have been some really amazing, creative, and innovative approaches. I think of the Ark of Refuge chapter that I talk about with Dr. Alexander DeSoto, who was, larger than life figure, opened up a hospital and a place where homeless people could live, and right along the waterfront during the gold rush. And and was also kind of a housing first model of care for that time. And he himself had been homeless, a recovering morphine addict. So I think of those two things, that, of really trying to dig down into what the reasons are that we've always had this really large number of people living here who are homeless, along with what innovations have worked and which ones haven't worked so well. Again, thinking about, the derivation in poor laws and how we replicate that even today. I mean, there's the whole intake thing and sorting for who takes priority for housing, and that system is pretty messed up. It's not working so well. So those are the things, and that, I bring it up to the present. I talk about some of the current kind of situation and exciting programs, like what I mentioned in terms of Jim Theophilus's work. But that is what I'm also working on with my next book, that is looking at kind of contemporary solutions to homelessness.
I was just going to say, maybe that would be a great final question, Josephine. We just have a 3 minutes left. Could you tell us, tell readers what we can look forward to next? Yeah, what you're working on.
Yes, what I'm working on. Yeah. Mm-hmm. So that it's working title right now is Way Home. And I'm really wanting to look at, okay, where are we now? And how did we get here? So, tying in some of the history, but more recent history for this book. And how do we, what's working, what's kind of innovative that just hasn't been scaled up for whatever reason? What are those reasons? What are the barriers? What are people doing to try and address those barriers? What's going on? And I'm widening it to, it's not just Seattle, it's King County. So also looking at suburban and urban homelessness in our county, which has a different face. And then the politics of it and the divisiveness of it, and how can we move past that? I mean, I just learned yesterday of the Third Door Coalition, which is, business people. The head of Pagliacci Pizza was up there with someone from can't remember which housing one, but it was also started by Sarah Rankin, who's an amazing lawyer and activist, from Seattle University here, purposefully limiting the number too. So it's not this like unwieldy, process heavy, which we tend to do here in Seattle. Drove me crazy when I first moved here. But that's part of our history. So that's what I'm working on right now.
Really exciting. Any kind of timeline, Josephine?
Timeline.
Maybe that's
tough. I have a couple publishers that are interested. I'm hoping it'll be finished within the next year, but it'll be an academic publisher most likely. Hopefully we'll not have a pandemic that delayed the publishing of Skid Road. So hopefully in the next year and a half.
That sounds great. We're looking forward to it. We're coming right up on the hour. I just wanted to say thank you again so much for joining us today. I really appreciate it. Thank you to all of our attendees. I'll be sharing out a full recording of this conversation, as well as ways to find your current book, Skid Road, and more resources as well. Yeah, but just wanted to say thank you so much for doing this.
Yes, and thanks everyone for your amazing questions. Really very good. Thank you.